Hello, my name is Jerusha Hancock. I'm the staff attorney with the Healthcare Access Program at Nebraska Appleseed. Nebraska Appleseed is a nonprofit, nonpartisan public interest law firm working for justice and opportunity for all Nebraskans. Today I'm going to be talking to you a little bit about what to expect from the Affordable Care Act here in Nebraska. Nebraska Appleseed has been working on healthcare reform and for the last few years, and I've been working on implementation of the ACA, looking at various policy and legal issues for the last 2 years. And so hopefully by the time we're done here today, you'll have a little better idea of what's in the Affordable Care Act and what you can expect in the future. So just a little bit of background. I'm sure most of you are aware President Obama signed into law the Patient Protection and Affordable Care Act on March 23, 2010. It was amended a couple of days later by the Healthcare and Education Reconciliation Act. Those two laws together make up the body of the ACA, or what some people call Obamacare. That law was signed, and it was upheld by the Supreme Court on June 28, 2012, but the Supreme Court ruled that the new Medicaid program was optional for states. And I'll talk a little bit more here in a bit about why that's important and why that makes such a huge difference. So it's important to understand that under healthcare reform, we keep our employer-based system of health insurance. That is the foundation of health insurance coverage here in the U.S. When the law was being debated, there was a lot of discussion about whether or not we wanted to keep our current system or if we wanted to go to something else like a single-payer system, and we opted to keep the system that we have. So that means that responsibility will continue to be shared among individuals, employers, and the government. So the ACA really focused on 4 main areas. The first is how to find and access insurance coverage. For folks who get insurance coverage through their employer, they're not going to see a huge difference here. But for people who are purchasing insurance on their own, who are very low income, those are the areas where the ACA was really addressing that access problem. So one of the ways that the laws changed things is by creating the new health insurance exchanges, otherwise known as marketplaces, where people can go and shop for coverage for themselves or for their family. There's also the new Medicaid program, which I'll talk a little bit more about here in a minute, but this makes Medicaid coverage available to everyone under 138% of federal poverty if the state opts in. And I do want to note that Kids Connection, which is the children's health insurance program, is still available in Nebraska for kids from families who make under 200% of the federal poverty line. So CHIP coverage, or Kids Connection, will still be an important source of coverage for children here in this state. The other areas that the ACA focused on were how to afford coverage. Part of that is the Medicaid expansion. Part of that is there are the new tax credits or subsidies that are available through the exchange. The third area is how to ensure that the system is fair and that people are getting value for their premium dollar. And then finally, how to change our healthcare delivery system to control costs and focus on prevention. Right now, we have a very reactive system, generally speaking. A lot of times people don't go see the doctor until they're sick. Sometimes they'll wait until they're very sick. We want to help people get the preventive care and immunizations they need, as well as getting those really important yearly physicals and cancer screenings to ensure that we're catching problems early when they're still less expensive to treat. We also want to encourage people to manage chronic conditions like asthma or diabetes, so they have things like their blood sugar or their asthma under control and aren't winding up in the emergency room when things get critical. So I think it's important to note where we are today. A lot of people, it's been 3 years since the law was passed. Folks, I think, have a tendency to forget where we started from and why healthcare reform was needed in the first place. So right now, people currently get insurance through their employer, through Medicaid and or Medicare, or the individual market. And for the most part, really, shopping on the individual market can be very frustrating and confusing. There's no one place to go to compare plans. A lot of times the information was confusing. You might not know exactly what your plan covered. And so the individual marketplace was a confusing and a difficult place to navigate as far as purchasing coverage on your own. In addition, insurance companies currently don't have to sell to you, and they can deny you coverage on the basis of a pre-existing condition or not cover certain services or treatments. So for example, those who have been sick in the past might not get health insurance. Those who lose their jobs or switch employers can be denied coverage or treatment for their conditions. And things like maternity care, mental health and substance abuse treatment, and pediatric dental and vision might not be included in your plan. This leaves a lot of gaps and holes in the system, and those folks still end up getting care, but generally speaking, they get the most expensive care, and it results in a lot of uncompensated care, which we all end up paying for. So going forward, people are going to continue accessing coverage through their employers, but in addition, the law created exchanges or marketplaces. Nebraska opted for a federally facilitated exchange. And then there was also an expansion of Medicaid, making it available to everyone under 138% of federal poverty. Nebraska has not yet opted into the new Medicaid program. That will be a decision that we address again this coming legislative session. So starting off with some of the least controversial aspects of the law, the consumer protections that are already in effect include the ending of denial of pre-existing conditions for children. This was really, really important for families who had kids with illnesses, either serious illnesses like cancer or chronic conditions like diabetes or asthma, who wouldn't be able to get their kids covered and would have to pay for all medical expenses out of pocket. That's no longer the case. It also banned copays and out-of-pocket expenses for preventive care and immunizations on all new plans. So when you go in for your yearly physical, for your colonoscopies, mammograms, other kinds of preventive screenings like that, you're not going to be asked to pay anything out of pocket. This is part of our effort to focus more on preventive care. Also prohibits lifetime benefit limits in all plans. That means that for folks who had serious illnesses or even accidents, they would run up against a lifetime benefit limit, and then they would have to pay everything out of pocket after that. That ended, there are no more lifetime benefit limits. It extended dependent coverage to age 26 in all plans, so young adults can stay on their parents' insurance for longer without necessarily having to be a student. This is really important for young adults who are just starting out, who may not have a job that provides benefits right away. And then insurers cannot drop you when you get sick. In the past, what you would see sometimes is someone would get a serious illness and their insurer would say, oh, if you had told us that you had acne as a teenager, we would never have covered you in the first place, and they would drop you from the plan. And they can't do that anymore. 2014 is when the rest of the reforms and the consumer protections take place, and a lot of these are really, really important. So for example, it prohibits denial of coverage for pre-existing conditions for everyone on January 1st, 2014. So for folks who have been ill in the past and haven't been able to get insurance coverage for months or years, will now be able to get coverage. In addition, it changes what insurers can look at when setting premiums. They can't set different rates based on your health status or your gender, meaning they can't charge you more if you've been sick in the past, nor can they charge you more if you are a woman. The only things they can look at are age, which is limited to a 3-to-1 ratio. This is important because Nebraska has unlimited age rating, which means that folks in that 55 to 64 category, so before they're eligible for Medicare, can end up spending 7 times as much as someone who's younger. The other things they can look at include geographic areas, so what are people in your general vicinity paying for health care, family composition, so who are they covering and how many, and tobacco use, and that's limited as well to a 1.5 to 1 ratio. In addition, there's guaranteed issue and renewability in 2014, which means insurers can't refuse to sell to you. If you really want that Blue Cross Blue Shield plan or the Coventry plan or whatever other plan works best for you, you don't have to worry about that insurance company denying you coverage. And you can continue to renew it as long as the insurance company offers that plan. It also prohibits annual limits for 10 essential services, which I'll go over more in a minute. But it means that if your treatments fall into one of those 10 service categories, there are no annual limits for what is covered. It also creates a standard benefit plan for all new policies. This doesn't apply to existing individual and employer-sponsored plans, but those are, generally speaking, being phased out, and so not many people will have grandfathered plans in the years to come. And then it also eliminates waiting periods for coverage more than 90 days. So the 10 essential health benefits that all plans have to cover if they're being sold in or outside of the federal health insurance marketplace or the state health insurance marketplace, if your state has a state-based exchange, are as follows. And the idea behind the 10 essential health benefit services are these are services that evidence showed that a lot of people needed at some point, and so every plan has to cover these services. It sets a floor for coverage for everybody to ensure that people are getting quality health insurance coverage. So for example, all plans have to cover ambulatory patient services. This means doctor's visits, outpatient services, emergency services, maternity and newborn care, mental health and substance abuse disorder services, which must be offered at parity with physical health services, prescription drugs, rehabilitative and habilitative care, laboratory services, preventive and wellness services, and chronic disease management, and pediatric services, including oral and vision. As I said, this is really important just to establish a floor for insurance coverage to make sure that people are getting the services they need. And not everybody will need each of these services, but a large majority of people will need a large majority of these services, and that's why we ask all plans to cover them. Going forward, a lot of people are really not going to see much difference. I know folks who purchase their own insurance may have gotten a letter from their insurance company saying their insurance company is no longer offering that plan. But for the most part, folks who have employer-based coverage aren't going to see a huge difference. But people who are purchasing coverage on their own now can get coverage through an exchange. And the health insurance exchanges were intended to be a competitive marketplace where individuals and businesses could shop for private health insurance plans or enroll in public benefits programs with the help of easy-to-understand information on all their options. Exchanges are open to individuals and small businesses with up to 50 employees, so 49 or fewer employees. They're also the entry point for tax credits for purchasing coverage for individuals, and they contain strong consumer protections as well as other standards related to marketing, the network of providers, etc., for qualified plans selling in the exchange. The idea being that we would encourage insurers to compete for business in the exchange, and consumers could go to one place to compare plans and make their selection. That was the idea behind the exchanges. how competitive they are a lot of times really depends on how many insurers are operating in that state and how many plans are being offered. Right now, Nebraska has, I believe, 3 insurance companies offering plans inside the exchange. That would be Blue Cross Blue Shield, Coventry, and Co-Opportunity Health. So as you may know, Nebraska has chosen to have a federally facilitated exchange. That's one that is run by the federal government but is just for Nebraskans. And the goal is to make it a one-stop shop for people for private coverage, Medicaid coverage, and accessing tax credits. Right now, the website as of November 12th, is still not working quite as well, but people can still sign up for health insurance coverage and for tax subsidies over the phone or with a navigator or other in-person assister. So there are still options for signing up, even though the website is not working quite so well. The federal government has stated that they believe the website will be functional by the end of November. So the tax credits being offered are only through the exchange. In order to get the tax credits, you must purchase coverage through the exchange. The tax credits are there to assist with the premiums for eligible persons with incomes between 100 and 400% of the federal poverty level, which is about $19,000 to $76,000 for a family of 3. I believe for an individual it's somewhere around $11,000 to $45,000. Federal poverty levels are set by the federal government each year. 100% federal poverty level is that level of income where you are considered to be living either in poverty if your income is below that number or above poverty. And the more you make, obviously the higher up you go as far as where you fall on that scale. Tax credits for premiums are based on your income. It's on a graduated scale. So for example, people between 100 and 133% of federal poverty will pay 2% of their income towards the premium. And the more you make, the more you'll be asked to pay as a percentage of your income. Cost-sharing subsidies are also available to help limit the out-of-pocket costs for care. The cost-sharing subsidies are available to people making under 250% of the federal poverty level. And again, the more you make, the less in cost-sharing subsidies you will be offered. Individuals are not eligible for premium credits if they are offered coverage by their employer unless the employer plan does not meet certain minimum standards and the employee share of the individual premiums is more than 9.5% of income. Nor are individuals eligible for tax credits if they're eligible for Medicaid. And to please note, affordability is based on what the employee pays for their individual premiums, which means that if the cost for a family premium is more than 9.5% of income, that does not necessarily make it unaffordable for purposes of eligibility for tax credits. Now, that may be unaffordable as a matter of fact for a family, but you won't be eligible for tax credits unless the premium is more than 9.5% of your income for the individual premium. However, it's also important to note that plans sold inside the exchange may be less expensive on a monthly basis if you want to purchase a plan at full price. So please do investigate all your options. Plans offered in the marketplace are based on metal levels and actuarial value. So obviously, the more you pay in premiums every month, the more that plan will cover. And what they have to cover is set on what's known as actuarial value, which means the actual cost that the plan covers. So for example, a platinum plan will cover 90% of your medical costs, a gold 80%, silver 70%, bronze 60%. The more you pay every month, the more the plan covers. So you'll pay little per month for a bronze plan, but more per month for platinum. You'll pay more out of pocket for actual medical expenses on a bronze plan, though, and less on a platinum. Again, you'll want to select your plan on the basis of what you need out of a plan. Young adults under the age of 30 can purchase catastrophic plans that only begin coverage after a large amount of out-of-pocket expenses, but even catastrophic plans are required to cover a certain number of preventive services and visits per year. So a catastrophic plan may be an attractive option for young adults who are otherwise healthy. So all of this is based on what's known as MAGI income. So where you fall on the federal poverty level and what tax credits or cost-sharing subsidies you're eligible for is based on MAGI. MAGI means Modified Adjusted Gross Income, which is your adjusted gross income plus any foreign earned income excluded from taxes, tax-exempt interest, and tax-exempt Social Security income. Assets are not taken into consideration when determining income. That means that you might own a large amount of land, but not have much in cash income per year. So the land that you own or the vehicles that you own would not be taken into consideration when determining your household income. Any income from a tax dependent who is part of the household is also included in MAGI. That means if you have a teenage or college-age child, for example, who has a job, if they make enough to file taxes, their income will be considered part of your income for purposes of determining MAGI. So please take that into consideration as well when you're looking at where you might fall as far as tax credits go. Child support received is not included in MAGI, and self-employment and farm income after depreciation and deduction of capital losses is counted. All of those things you'll want to take into consideration when you're estimating your income for the next year for purposes of determining how much in tax credits you're going to get. As I mentioned before, while federal poverty levels are based not just on household income but also household size. So for the more people you have in your household, basically the more money you have to make to be over the federal poverty level, or the more money you can make and still be under 400% of federal poverty and be eligible for tax credits. So the household size includes the tax filer plus the spouse, if any, and any tax dependents. That includes any unrelated adults or even related adults that live in your household, assuming that they meet the criteria. You have to be providing most of their support. They can't be making more than, I think, it's somewhere around $3,000 a year. And so those folks are also included in your household. College-age children that are still your tax dependents are also included. And please note that if you are married, you must file jointly in order to be eligible for tax credits. You cannot be married filing separately and still qualify for tax credits. Parents and step-parents are treated the same way. The key here is legal responsibility. So if you and an ex share custody of a child, one of you can claim the child, the other one would not be able to claim the child as a tax dependent. As I mentioned briefly before, cost-sharing subsidies are available to those in the marketplace who are making under 250% of federal poverty. These are based on a percentage of your income, and it limits the out-of-pocket expenses a person or family would pay. So, for example, those under 150% of federal poverty will have additional reductions in cost sharing, so the plan's actuarial value would be increased to 94%. Cost-sharing subsidies are only available if someone selects a silver level plan. Obviously, for someone who's very low income, under 150% of federal poverty, selecting a silver level plan would not only limit would limit their out-of-pocket expenses to no more than 6% of actual medical expenses. That's better than a platinum plan. Obviously, as you approach 250% FPL, I think between 200 and 250%, the cost-sharing subsidies increase actuarial value to something like 74% of actuarial value. So you'll have to make a determination whether or not it's worth selecting a silver choice plan or whether or not you would prefer a bronze level plan at that point. So keep that in mind as you're selecting your plans. So looking at the available plans and premiums, I mentioned that there are at least 3 carriers now in Nebraska offering plans on the exchange. It's important to note that the portion a person pays is based on their income and the number of people to be covered. So you can see the levels here. For example, someone between 100 and 133% of federal poverty would pay 2% of their income, which is about $39 to $52 per month for a family of 4. As you make more, you'll be asked to pay more until you get up to 300 to 400% FPL. You would be asked to pay 9.5% of your income, and that's $559 to $745 per month in premiums. Again, that's for a family of 4. The advanced tax credits to help pay for the premiums go directly to the insurance carrier, and the individual pays the difference. So the tax credits essentially reduce the amount that you pay every month in premiums, and that money goes directly to the insurer. It is important to note that while these tax credits are advanceable, meaning you do not have to wait until you file your taxes in order to get tax credits, they're also refundable, meaning that if someone receives more in tax credits than allowable, they will have to pay them back. So for those under 200% of federal poverty, the amount they would have to pay back would be $300 for a single person, $600 for married filing jointly, a maximum of $1,250 or $2,500 for under 400% of federal poverty for a single person or a family, respectively. But you have to repay the full amount if your income goes over 400% of federal poverty. That means that, for example, if you are between 100 and 400% of federal poverty and you get a great new job or you get a significant raise at work that's going to increase your yearly income, you need to report that change to the marketplace immediately so that the amount that you are getting in tax credits is reduced, which limits your liability when you file taxes the next year, and they determine how much you actually made that year and how much in tax credits you should have gotten. The individual responsibility provision is one that's gotten a lot of bad press, but the idea behind this is to broaden the risk pool and ensure shared responsibility. When the law was being debated, the insurance companies basically said, if you're going to make us cover everybody, if we can't exclude sick people, then you have to make everybody join in, because the whole idea of a risk pool is that everybody pays in a little bit and then everybody gets covered. It's important to note that if you live long enough, you're going to get sick or you're going to have an accident, and so you're going to need health care. So even if you're healthy now, you pay in so that later you'll be covered. It's also important to note that folks who do not have insurance coverage are not necessarily not getting services. They're just getting the most expensive services, and all of that cost, or a lot of that cost, gets passed off to the rest of us, and our insurance premiums go up. So by asking everybody to have coverage for when the inevitable happens and we get sick or we get into an accident, we ensure that everybody's sharing in the responsibility. So the requirement is that all U.S. citizens and legal residents have qualifying health coverage that meets certain minimum requirements. And the penalties are relatively minor to start with. It's about $95 or 1% of income for the first year. It's going to be phased in between 2014 and 2016. The maximum in 2016 is about $695 per year, up to a maximum of 3 times that amount per family, or 2.5% of household income. Some people will say that it would be that it would be cheaper to pay the penalty than it would be to carry insurance, and that might be true. But if you don't enroll during the open enrollment period and you get sick during any other point in time in the year and you need health care services, not only will you be paying the penalty, but you'll be paying all of the costs for your medical care out of your own pocket. So that's the gamble that people are going to have to decide whether or not they want to take. But the individual responsibility provision was upheld by the Supreme Court as a tax, and it will be collected by the IRS as a tax when folks file their income tax returns. There are exemptions for this provision. For example, financial hardship, religious exemptions, undocumented persons, American Indians, incarcerated persons, those with short gaps in coverage of 3 months or less, those with income below the tax filing threshold, and if the lowest cost plan exceeds 8% of income. So with that last provision, for a family who has the lowest cost plan available to them is more than 8% of their income, they will not be penalized for not having health insurance coverage. Obviously, that does not help them get coverage, but at least they won't be penalized if they can't afford it. And that's the general idea behind this. Is everybody who can afford it, we want them to get covered so we can reduce uncompensated care and make sure everybody's getting the services they need. If you just cannot afford it, then we're not going to make you purchase something you can't afford. We also ask that employers share in the responsibilities. So small employers with under 50 employees are not required to provide health insurance, but employers with 50 or more employees are required to provide health insurance or pay a penalty. They're only required to provide insurance to full-time employees. Full-time is considered 30 or more hours per week. The number of employees is counted by full-time equivalent hours. So if you have 100 employees and all of them work 20 hours a week, you add all of that together and you get over 50 full-time equivalent hours, over 50 employees. The employers pay a penalty when employees access tax credits. So if an employee makes too much or too little to get tax credits, there is no penalty for the employer. And then the penalty is $2,000 per employee. Employers with 200 or more employees are required to automatically enroll employees in a health care plan. So the Medicaid program was determined to be optional for states under the Supreme Court decision. And it's probably important to talk about a little bit about how Medicaid works now. Medicaid is a state-federal partnership program that provides health insurance to certain groups of low-income individuals. It's been around since about 1965. It's voluntary for states. They can sign up or not as they choose, but every single one of the 50 states does participate in the Medicaid program. And so it's based on categorical eligibility, which means you have to fit into one of the 4 categories listed here, and income. So your income has to be below a certain amount. So for example, children are eligible for Medicaid or for the Children's Health Insurance Program up to 200% of federal poverty. Pregnant women are eligible for pregnancy-related services only if they make under 185% of federal poverty. Very low-income parents or caretaker relatives must be making approximately under 54% of federal poverty, and then the aged, blind, and disabled have to be making under 100% federal poverty to be eligible for Medicaid. The Affordable Care Act added 2 new mandatory categories, though. The adults under 138% of federal poverty, which is now an optional category after the Supreme Court decision, and former foster children up to age 26 with no income limitations. Obviously, the new adult category covers essentially childless adults who currently have no access to health insurance coverage if they aren't provided it by their employer or are paying for it on the individual market. And childless adults include people who have no children, but also older folks, like say 55 to 64, whose children are gone and out of the house and are no longer dependents. So this includes your neighbor who may have gotten laid off during the recession and hasn't been able to find another job, but also the single mom who works 3 jobs, none of which provide health insurance coverage since she's not a full-time employee. Medicaid was always intended to be the foundation of coverage for low-income adults under the ACA because it's a lot cheaper to subsidize or to cover people under Medicaid than it is to subsidize their insurance. Generally speaking, it's about 50% cheaper to cover someone under Medicaid than it is to provide subsidies for private insurance. And when the law was written, obviously we did not know at the time that the new Medicaid program would be optional for states. It was initially conceived to be a mandatory coverage category. That means that because tax credits are only offered to folks making between 100 and 400% of the federal poverty level, folks who are under 100% of FPL can't get tax credits through the exchange and have no path to coverage, creating a large gap in coverage. Obviously, once a state opts into the Medicaid program, which is fully funded by the federal government for calendar years 2014, 2015, 2016, they do have a path to coverage, but a state has to opt in. Generally speaking, Medicaid eligibility is aligned with tax credit eligibility in that both use the same rules for modified adjusted gross income and for household size. The ACA applies MAGI to all eligibility categories going forward except for former foster children and the aged, blind, and disabled. Former foster children have no income limitations. This puts them in the same position as children with insured parents, who can stay on their parents' insurance until they turn 26. A foster child who ages out in Nebraska can retain Medicaid coverage until they turn 26. The aged, blind, and disabled will continue to have the same income, resource, and asset tests that they do today to be considered eligible for Medicaid. But if a disabled person is ineligible for Medicaid under the AABD category, they can be eligible if the state has taken up the new Medicaid program up to 138% of federal poverty. As you'll remember, aged, blind, and disabled are eligible for Medicaid up to 100% federal poverty. Many times they couldn't get any kind of insurance coverage if they lost Medicaid coverage. With the ban on denials for pre-existing conditions and the ban on charging more on the basis of health status, disabled individuals will be able to access health insurance in ways they were not able to before, but Medicaid coverage is still a very important means of coverage for the disabled population. The same rules for MAGI and household income and size apply, as I talked about with the tax credits, but there is an exception made for unmarried parents who are living together with their child or children, they are counted as a single unit, versus an unmarried couple living together for purposes of premium tax credits would be counted as separate households unless one of them is a tax dependent on the other one. So one of the things that the ACA also did to help people navigate this new system is to create two separate programs. The first is the navigators. Navigators are there to help people in person to choose the plan that's best for them. So Community Action of Nebraska and Ponca Tribes of Nebraska each received federal grants to conduct outreach and facilitate enrollment in qualified health plans in the marketplace. They're required to complete the federal training, which is approximately 20 hours, take and pass the certification test, and then also register with the Nebraska Department of Insurance. They're required to conduct consumer outreach and education, provide fair and impartial information, and facilitate enrollment in a culturally and linguistically appropriate manner. And so if you need help getting signed up, Community Action or Ponca Tribes is a really good place to go to ask for assistance in signing up for a new health plan. The ACA also created certified application counselors. These folks aren't going to receive federal grants, but they are required to complete federal training, which is going to be made available for free to the general public, and take and pass the certification test. They're expected to facilitate enrollment in qualified health plans and educate the public about the exchange. The CACs will be performing these duties as part of their regular work, and CACs certification is limited to providers, hospitals, community health centers, or social service agencies. These are, generally speaking, these are folks that will be assisting people in getting enrolled as part of their already existing work. These are groups that want people to get enrolled in a health plan and or are already assisting folks in getting signed up for public benefits programs. Many of these dates have already passed us by or are fast approaching. Navigator grants were awarded and the grantees were announced this last summer, and the federal government released the training modules for the CACs. Open enrollment in the exchange began on October 1st, 2013. But January 1st, 2014 is when the major reforms take effect, including the ending of denial for pre-existing conditions and guaranteed issue. Also, if you sign up by December 15th, coverage in the exchange will begin for you by January 1st, 2014. So obviously, if you need your coverage to begin January 1st, you want to sign up before December 15th. Open enrollment ends on March 31st, 2014. There have been some folks who've been talking about extending that deadline. It has not been extended yet, so keep an eye out for that. But for right now, open enrollment ends on March 31st, 2014. That means that if you don't sign up for health insurance by that date, you will have to wait until the next open enrollment period, which is October 7th through December 15th of 2014, for coverage beginning January 1st, 2015. So unless, of course, you trigger one of the special enrollment periods, which is essentially if your insurance coverage changes. So if you have a birth, a death, a marriage, a divorce, you change jobs or move to a different state, you lose your job, all of those events will trigger a special enrollment period, and you'll have a set amount of time to enroll in coverage or different coverage. The open enrollment period is also when you can change plans if you don't like the one that you selected. It's important to note that unless you trigger a special enrollment period, you cannot sign up outside that period, which means that if you don't sign up by March 31st and yet you get sick sometime in between April 1st and October 6th, you will be paying those medical expenses out of pocket, and you will probably not be able to get signed up for coverage. So take that into consideration as you're deciding whether or not to sign up. So you can go to healthcare.gov for more information on the new marketplace. This is where you would go to sign up and find out what plans are available to you as far, and also what kind of premium tax credits you're eligible for. The website is not working great, but it's getting better every day. Definitely see if you can get signed up. There's also an 800 number that you can call, or if you want in-person help, you can go to www.canhelp.org. And there are a number of community action sites across the state, and the navigators there will be happy to help you get signed up. So some frequently asked questions that I get a lot when I'm out and about giving presentations. Obviously, these are non-exhaustive. You may have questions yourself. If that's the case, you can contact Nebraska Appleseed. We're always happy to talk to folks in the community and to answer questions if we can, or at least point you in the right direction. So one of the questions we're getting a lot right now is, my insurance company discontinued my plan. Why is that? Well, it could be for a whole host of reasons. The important thing to keep in mind is, first off, insurance companies make business decisions all the time as to which plans they would like to offer and how much they're going to charge per plan for premiums, what the deductible is going to be, and that sort of thing. The ACA does put limitations on and more stringent requirements so that when you do buy a plan, you are getting a certain minimum value, and you know that that plan will cover certain things. That's part of that 10 essential health benefits. So it is entirely possible that your plan did not meet certain minimum value requirements, and that's why it has to be discontinued. If you lost a plan that you really liked, hopefully you'll be able to find one that you like just as well in the exchange. So keep that in mind. Insurance companies make business decisions all the time. Some of it may be new requirements imposed by the ACA, but some of it may just be because it was a business decision. Another question I've gotten, I share custody of my child with my ex. How does that impact my eligibility? If you are claiming your child as a tax dependent, or whoever is claiming that child as a tax dependent, that child would be included in their household income and household size for that year. That means that if you have ex-spouses and one has physical custody of the child and claims that child as a tax dependent, they would be a household of 2 for purposes of determining premium tax credits and or Medicaid eligibility. Obviously, depending on what your income is, adding another person to your household can impact your eligibility for tax credits, cost sharing subsidies, and Medicaid and or CHIP coverage. If your income is under 100% federal poverty, that can, not claiming your child could push you over 100%, which would render you eligible for tax credits. So this is something that you would want to discuss with a navigator or even with an insurance agent or broker. Discuss it with the other person who may be eligible to claim the child as a tax dependent. Figure out which route works best for you and for your family. My child is over the age of 18 and family coverage is expensive. Should I continue to cover my adult children? This is, again, a decision that each family is going to have to make. Please keep in mind that if someone is part of your household, if they're tax dependent, any income they make is part of household income, which can change eligibility levels. It could be that your adult child who's over the age of 18 would be eligible for tax credits on their own, or would be eligible for Medicaid coverage, which might be a better deal for them, depending on what their circumstances. The best thing to do is to investigate all of your options, see what changes, and make your decision accordingly. Again, you can contact Nebraska Appleseed with any questions you may have. If you're having difficulties, either you think you should be eligible for Medicaid, and because we have not taken up the Medicaid expansion, you fall into the coverage gap, we would love to hear from you. We would love to hear from you if you're experiencing problems as far as being denied coverage for a pre-existing condition, which obviously should not happen, or if you have a great story to tell us about how you're now eligible for coverage and you weren't before. We love hearing from folks. You can call us at 402-438-8853. Ask to speak to our intake coordinator, Tricia. She will be able to direct you to the right place. So I want to thank everybody for listening, and I hope you all have a great day.